Good morning, everybody. We're just waiting a minute for everybody to join the webinar. We'll start in 1 minute.
Good morning.
Okay. Good morning. Hope everybody is well today. We are very, very excited about this new program that we're going to be offering at MBIA, health insurance. I've been with the association for about 13 years now, and this is definitely an area that we've been trying to figure out how to make this work for our members. So we're very excited about this program. Obviously during these very trying times in this world, we're trying to come up with creative ways to offer value to our members. Everybody's struggling. Everybody's trying to figure out how they are going to operate in this new environment. And we're trying to figure out new and creative things that we can do as an association to offer better benefits and help our members save money. That's always a goal in offering them some new things that they can do. So we have this new health insurance program. You're going to hear from several different people that'll kind of walk through the program and some other things. One thing I do want to point out, and you'll hear more about this through the presentation, is we have an open limited time to get the census data in for some of the programs. So that is due by May 18th. So it's very important if you want to participate that you get that information in as quickly as possible. You can see in the chat function, we'll post the website information. There'll be some other information that'll be posted throughout this webinar. So please, feel free to go ahead and play around as we're talking. Also, we will have a question and answer section at the end. So if you have any questions throughout the webinar, please post in the chat or the Q&A. And then at the end, we'll also have the option where you can use the raise hand function. So feel free to put things in there if you want to really ask the question in person. That's fine as well. So we're going to go ahead and kind of start. I'm hoping that you can get some benefit from this. The other thing I do want to point out, just so everybody knows, this also benefits MBIA. As you can imagine, we're having some financial struggles as well right now, just with our inability to have events and that type of thing. So this is a benefit for MBIA as well. So there is the dual benefit of helping our members, but also helping the association and the industry as we move forward. So I think that's an important piece of it. One other note is if you are happy with your insurance and you're not really looking for this, there is also the opportunity to just switch your broker. That also could help the association moving forward. So a lot of things, a lot of different options out there. Obviously, after this webinar, there's also resources if you want to reach out and ask specific questions that we didn't get to during the webinar. Please feel free to do that as well. So without any further ado, I'm going to go ahead and turn the floor over to Mark Kaufman and Peter Cole from the Warner Companies, and they will start us off.
Hi, thanks, Lori, and good morning to everyone. First and foremost, we want to thank the staff of MBIA, also the executive committee, the board of directors, and a special thanks to CEO Lori Graff, as well as membership director Chris Bond. We're excited. We have a terrific program that we're going to be introducing to the organization today with a number of proprietary products, technology, billing, administration, a lot of different things. So we're going to try and get all this done in about 30 to 35 minutes, and then we will have a Q&A session with all of the members. So with that being said, let me turn things over to my colleague at the Warner Companies, Peter Cole. Peter?
Thanks, Mark. Again, my name is Peter Cole. I'm with the Warner Companies. I'm going to spend just about 4.5 minutes, that's my allotted time, for a very quick overview of how the program works. And what I'm going to do is I'm going to walk through a brochure that you can find on the website. And later in the presentation, Joseph Carey is going to show you where you can find that. And but I'm going to walk through this presentation to just kind of quickly describe the various elements that are part of the program. So Joe, you want to get me to the next page? So look, there's two areas really. There's group health insurance and there's individual health insurance. And there's products in each of these categories that are going to be very flexible so that there are an array of products, one of which is almost guaranteed to meet your needs. So the first couple of products are fully insured products. Level funded is, for all intents and purposes, a fully insured program but it allows you to earn refunds if you have favorable claims experience. We've got 2 companies that service that area. One is called Aetna. I think you're probably familiar with them. One is called Legend. We've got some fully insured products from CareFirst and Kaiser. And it's this area of Kaiser where we would want you to send in census information. And what Kaiser is going to do here is give us a fully insured program based on the volume of censuses that come in ahead of time. So if you send your census in now, and we're going to get rates based on that volume. And so there's a couple of categories, and I'm going to talk about the first one here. Employers with 51 or more benefit eligible employees. So benefit eligible, don't have to be participants. We need you to send your census in, and Joe's going to show you how, so that Kaiser will rate this program on all of the census materials that come in. Now, if you send your census in, you're not obligated to participate in the program. The third program that we have here is a smart HRA. Rob Dooley is going to talk about that. Kaiser is, Christy Sabatka from Kaiser is going to talk more about that. But I want to show you a couple of quick things here before you go on. These buttons here, I would encourage everybody, the first thing you want to do here is download this brochure and go to these buttons here, and they will take you to exactly the place in the website that are going to provide you more information on that. So let's talk a little bit about the fully insured products here. We have some I think I covered level funded. Level funded is a program that looks and feels like insurance, but you get refunds if you have favorable experience. So if you've got a healthy workforce and you know you have a healthy workforce, this is going to be a great program for you. The fully insured programs are from Kaiser and from CareFirst. There's going to be a variety of plan designs that you can participate in. And again, when you want more information on those, click on those buttons and they'll take you to the right place. The third program is something that Rob Dooley is going to give us more information on. It's really unique. It's a smart health reimbursement account, and it's a very clever program to get affordable benefits at low costs. Now I'm going to run through the individual products really quickly because they're pretty much, they're very similar. So one of the individual products is you can buy an individual Kaiser Permanente a benefit plan. And so this is really for employees who are 1099 employees, sole proprietors, or for employees that are employed by smaller companies that don't have any benefits. So if you're a 1099, or if you're an employer with a lot of 1099 contractors, send your census in. If you're a sole proprietor and you're interested in Kaiser, but you don't want to be obligated, send your census in. And the same way with smaller employers who don't have any benefits, send your census in. We're going to rate this all together, and then you're going to have the option to participate in Kaiser if you want to. Select Med Essential is basically kind of a minimum coverage product for employees, individuals who just want minimum affordable coverage. And then the Affordable Choice Plan, number 3, provides basic medical coverage, hospitalization. It's not a major medical plan, but it provides a very good level of basic coverages. So scroll down just a little bit more, Joe, and you'll see at the bottom of each of these pages, there's sort of a guideline that help you pick the plan that's right for you. So that's a very general overview of the product and the product selections that are part of this program. When you go to the website, Joe's going to show you how to click on more information, download this, use this as your benefit, as your basic guide of what the choices under the program are. And there will be a place to go for questions along the way if you need more information as you look at the options throughout the program. So with that quick introduction, I'm going to pass it over to Christy Sabatka from Kaiser, and she's going to tell you in more detail about the programs that are available there.
Morning, everybody. Thank you so much for letting me join. I appreciate it. So I'm going to go over how Kaiser Permanente works in a little bit of a quicker fashion. We have about 10 minutes here. Like Peter had said, this would be for anyone who's 51 eligible, those groups to do an association plan, as well as any of your employees that have 1099, I think it's important to note that if you have some employees that are 1099, they haven't been able to have something like this before where they can get insurance. And it is something that the employees get billed for the premium. I think it's important to note that you as the employer will not be billed for that premium. It will go direct to the employees. So I would say send it in so we can check it out. I think right now is really an important time to obviously have insurance. So hopefully we'll get some employees that didn't have it before will consider it. So the way that Kaiser works, I think there's always been a stigma about Kaiser out there. I think it's kind of an old thing, but just to let you guys know, we have a few products. So the way that Kaiser works is we do have our medical centers you'll see on this map here, as well as we have some super centers. If you want to go to the next slide, you'll see a picture of them here, and we can go right into the next slide as well. So the point of Kaiser is to have these medical centers. They're smaller centers where you can get your basic primary care needs, OBGYN, pediatrics, lab, radiology, pharmacy, and a few different specialties all in one location. Those are 34 different medical centers. Our super centers that you see on this slide here, super center is going to be basically a mini hospital. It's going to offer everything I mentioned in a medical center, but a ton more specialties. So usually it goes up to about 35 different specialties, advanced imaging, 24/7 urgent care, as well as outpatient surgeries. And the reason that we offer this is because this really cuts down on cost. It allows you to go to kind of a one-stop shop, if you will. All of our medical centers are and act that way, as well as our super centers act that way as well. It's a fantastic thing and feeling to go in and see multiple different doctors in one day versus having to schedule seven different appointments, for example, weeks out and have to drive to different locations. So it's a really great thing and feel. And it's nice if you go into our urgent care facility for, let's say your appendix has burst and you can actually just hop on up to our outpatient surgery if you want and get the surgery done right then and there, avoiding the emergency room. So it's a really great way to, save time, save money, and cut down on costs for employers overall. One of the important things to note with Kaiser is because of models and things like this in our system, we are always going to be about 15 to 20% below in your overall premiums than any other carrier out there. So I think because of the stigma with Kaiser, we've had a lot of groups that maybe are concerned about moving to Kaiser because they don't want to leave their providers. So even though we have this model here, I think it's really important for me to make sure that you understand several things about our model. We have a bunch of different plans where you can actually go outside of our network. You can keep the provider that you have now and also have access inside Kaiser to utilize the Kaiser services. And again, I like to harp on this, but saving 15 to 20% below in your premiums. As well as you can also go to outside pharmacies too, so you can keep those high-level pharmacies that you have. This slide here I kept in because it doesn't explain Kaiser per se, but I think it's important to note that our providers are always top doctors, are always recognized by their peers as leaders in the field. We have most of our providers honestly come from Harvard backgrounds, Georgetown backgrounds, and a lot of them are snagged from Hopkins. Right now, the head of oncology, or was the head of oncology at Hopkins, is now the head of oncology at Kaiser because they truly get to come in and practice medicine. They don't need to deal with billing. So I just wanted to go over that slide because I do think it's an important piece to this to make sure you understand if you come in, the providers are top doctors. I was going to skip this slide, but actually let's stay here real quick. There's a few things I do want to pinpoint. Kaiser's job is to make your life easier. We don't need you to come in to see your provider for everything under the sun. Providers have kind of changed the world to, they need you to come in because they need to grab that copay. Well, Kaiser's job is to save you money and save you time as well. So there's ways that we can do that by doing a phone call with your provider. You can email your provider. I'll go over this on the next slide, but you can do face-to-face video appointments with your provider. You can view all of your records, schedule appointments and things like that. But the most important is this last bullet. We can actually remote a specialist into your room if you're at primary care or in most of our urgent care settings. So think about that. You go to see your primary care doctor, you have a rash on your arm, and they say, I'm not really sure what that rash is. Let's remote in a dermatologist. And that dermatologist can say, hey, it's XYZ disease. You need this medication. So you have actually done one appointment at your primary care doctor, seen a dermatologist, and they've called in the prescription to that pharmacy that's right in that same building. Or, hey, you walk downstairs and get the lab that you need to determine exactly what that procedure is. Or on a side note, if they're not remoting in, they can actually, if the dermatologist is available to see you right then and there, you can walk down the hall and go and see that dermatologist, see that OBGYN, see the primary care doctor, go downstairs and pick up your prescriptions, get the lab work that you need or the x-ray that you need. It's a fantastic feeling to have everything in one location. And let's skip to the next slide here. Looks like I might be done early, which is great. This is an important slide, and it's especially important slide with what's going on in our world today. So the world has kind of done a shift to video appointments. Kaiser's always been very big on video appointments and doing telemedicine. One thing that we do is we do telemedicine for urgent matters. That's 24/7 for conditions like a rash, a wound, a bone break, shingles, sore throats. I'll say pink eye is a big one, where you don't need to go in. 70% of the reasons that you're going in for urgent care can be done via telemedicine. So instead of going in and being, potentially infecting someone else or getting infected with someone else with the way the world is today, you can do everything via a video visit with an urgent doctor. But a really important piece to this is this second bullet here. You can actually do telemedicine with Kaiser with your actual provider. So as long as you're seeing a Kaiser provider, I mentioned that you can see outside providers. So this would not work for that. However, you can do the urgent if you're seeing an outside provider. But inside Kaiser, if you're seeing a Kaiser provider, again, another way to save time and save money. For most of our plans, this is all a free service. So you go and you do a follow-up appointment with your provider for PCP. Let's think dermatology. Let's think GYN for certain questions that you have. Behavioral health, just to name a few. It's not every single specialty, but we are obviously growing that now as COVID and coronavirus are such a big deal. But this is a great way to save time and save money. And again, I just want to let you guys know, these are major medical health insurance plans. So you're getting full coverage in case something serious happens, in case, unfortunately someone does get infected with coronavirus. One of the things I do want to mention is that Kaiser is the only carrier out there that's charging nothing for coronavirus. The diagnosis, the treatment, any medications, etc. So it's important to note because that's a huge savings there. And then we will be about 15 to 20% below any other carrier out there. So if you're with another carrier, I recommend bringing your census in just to even get a quote from us to see what we can do. So thank you guys very much for having me here. We'll be here for the questions and answers as well. Thank you.
Great, Chrissy. Thank you so much. A lot of great information, and I definitely know the telehealth is something that, especially in this environment, is going to be a different philosophy moving forward. We did have a question. I believe you answered it and you touched on it. Is there an option to see a non-Kaiser specialist on the plan? I think you touched this briefly.
Absolutely.
So can you just talk about that a bit more?
Yep. Sorry, I didn't mean to cut you off. Absolutely. So with some of our plans that we will offer, there is an option to go outside and see and keep your specialist outside of Kaiser with the plans that we're going to go over and offer. So we can dive into more details when we pick the actual plans. But yeah, we're going to absolutely offer plans that have outside access. So you do not have to, you can keep your doctor. You do not have to switch fully into the Kaiser system.
Great. Perfect.
Thanks, Lori.
Okay, so we're going to move on to the Power Select individual products, and Rob Dooley.
Hi, good morning. I'm a specialist mainly in individual companies under 50, and I'm real excited about what Maryland Business Association is getting ready to offer you. This is more of a new approach, not a new plan. And I know many of you are like, where are the rates? And I'm going to show you an illustration of rates in a minute here. But this approach is all about the fact that a new law went in effect January 1st that allows employers to get out of the health insurance business altogether and give a defined contribution to their employees tax-free. And then those individuals purchase the plans themselves. Next slide. Okay. The employer gets out of the health insurance business, as we just talked about, and there's no longer where you all are trying to go to a high deductible to reduce rates to meet the needs of all your employees. each individual employee gets to decide what they want for their health insurance plan on their own. And the exciting thing, I think, is that we have plans on an individual basis that 94% of your employee population can have no deductible. No deductible, no high out-of-pocket cost. First dollar benefits when they go into the hospital. And I just want to give an example here now of a 50-year-old man or female. If you're 50 years old, there's a plan that gives you 100% wellness, telemedicine, unlimited, no copay. And I agree, telemedicine's the future. It's a big thing right now, and it's going to be bigger in the future. And then also gives you up to 5 office visits with just a $25 copay. It gives you x-ray and lab work with just a $25 copay. Gives you prescription drugs where you only pay 20% of the cost of generic drugs. And again, 100% wellness. And what's the cost? It's $102 per employee, no matter what your age is. Guarantee issue, no pre-existing conditions. I'll say it again, $102, guarantee issue. And how would it work? You could give a defined contribution to your employees and they would purchase these plans on their own. Going on with that example, that plan doesn't cover hospital and surgical. So what would it cost to have a plan that covers hospital and surgical? And that's the affordable choice plan. And when you add the affordable choice, you're getting first dollar benefits for when you go in the hospital. For example, first day in the hospital, you would get $5,000, and every day you're in the hospital, you get an additional $3,000. You'd also get 2.5 times the Medicare fee schedule for the cost of the surgeon. It's quite extensive benefits. And what's the cost? Well, for that 50-year-old male, when you add the primary care daily benefit with the hospital and surgical benefit, the cost is $365 for that 50-year-old male. Now, the question comes up, well, what if they need more coverage? What happens in individual HRA? Every employee gets a special enrollment period where they can go to the state exchange and buy a Blue Cross Blue Shield or Kaiser plan on the state exchange. And so I wanted to look at what the rates were on the state exchange versus group insurance. So today I went in and I ran that same 50-year-old male, and the rates, if you had group insurance with a $1,500 deductible with the Blue Choice Network, where you'd have $15 copays for the primary and $10 cost for generics. Right now, today on a group basis, that plan would cost $640. $640 for a 50-year-old person on group coverage with Care First. If you go to the exchange, you can get that same gold level plan with no charge to the primary care doctor. So you pay not $15, zero. You pay no charge for generics, none. With Care First, the same carrier, you can get that plan for $520. I think people think the exchange is more expensive than group insurance. It actually is cheaper. It's $520 today versus $640 today with the same carrier. So I think the exciting thing about individual HRA is it allows you to get out of the insurance business. You're no longer trying to pick one plan that meets the needs of all your employees, and we're going to give you the documents that make it easy, that complies with the law. So you get that all in the same package. Next slide. This is something I wanted to share with everybody because most people don't know this. This is from the Kaiser Family Foundation, and it's statistics on health insurance utilization. And you might not be able to see it real clearly, but it says that only 6% of the American population has a claim greater than $2,500 in a given year. So the question has to come up, why are you paying so much for health insurance when only 6% of the American population have claims greater than $2,500 a year? And the answer is because under the current arrangement, you're helping to pay for other people's claims that go over the 6%. And with the individual HRA approach, we have plans that are able to ask medical questions. And so you would be in the pool of people who don't have those 6% claims. And we're saving people as much as 50% on the cost of their health insurance. And I want to say that one more time. We're saving people as much as 50% on the cost of their health insurance. So that's what Smart HRA can do for you. And I look forward to getting census data and giving you quotes one-on-one later. Thanks.
Great, thanks, Rob. Real quick, those numbers you're quoting, that's monthly, correct?
Those are monthly numbers, yes.
Okay, great. Interesting. So I think there's obviously a lot of different plans here. So we're going to go, I know we've got a couple of questions, but I'm going to wait till we get to done with the website part of it. And I'm going to introduce Hamilton's Joe Zakari. Joe, if you want to go ahead and kind of walk us through that, and then we'll get to some of the questions.
Sure, thanks, Lori. Yeah, hi, as Lori said, my name is Joe Zakari, and I'm with Hamilton Insurance. And we're part of the group that's going to help administer these programs for MBIA as healthcare products. And so, first of all, thanks everyone for allowing us to present to you. Hoping you're finding it informative so far. What I want to do at this juncture is kind of switch gears a little bit. We've talked a lot about some really interesting and great products here, medical products that cut across a lot of the spectrum of different options that you have available to you. But the other half of the equation is talking about how simple it is to administer those programs because of some of the work that we've collectively done to try to make it that way. And what we've actually done is taken an approach that says we're going to create a platform for you that allows you and us to work with you and administer these programs as simple as possible so that you don't have to put a lot of energy into ensuring that your employees or you have coverage. And essentially what we've done is we've created this website that allows you to do two important things. One important thing is come to this site and we'll get you this information on where these sites are located, but it's basically straight internet access. But these sites will do two things, as I said. One, give you some great information about the product offerings that we just gave you a high-level overview of. And you can come here and learn about those products in a lot of different ways. So the first thing the site's going to do is allow you to learn more detail about the product. And the second most important thing it's going to allow you to do is you're going to be able to go through the process that you need to get a quote all the way through to enroll and understand how your premiums are paid. So two important things, information and administration of those benefits once you've decided that you'd like to do that. And so quickly, what I want to do is show you how both of those work. First, as I said, there's a lot of information on a variety of pages, and you can get there from a lot of different ways. If you're interested in level funding program, that's great. You can click here to learn more if you're interested in fully insured, et cetera. In addition to that, and each one of these, by the way, will take you to a page that gives you much more detail about that product and a little bit more about the process, but I'll come back to the process in a minute. The other way you can find out about these products is there's a toolbar at the top. Select the product that you're interested in. Again, it'll drive you to the detail around that product. In addition, we have some generic information about what are the medical networks associated with those different products that you might be interested in. So you can come here, learn about the networks that are available to you, look up a doctor to find out if that doctor is a part of this network that you're interested in or this product that you're interested in. So there's lots of good information here about networks and hospitals and providers and things like that. And finally, from an information standpoint, you can go to plan information, and we have lots of brochures and data about the products here that you can easily drill down on as you need to. And so that's essentially the information side of the website. good information here that you can drill down and get the level of detail that you're interested in, depending on the product that you're interested in. The second most important thing on this site is what's the process and how does this work? So once you've decided that I'm interested in one of these products, you can then go to that specific product area and learn exactly what it takes to get a quote all the way through to enrolling and getting billing and premium payment for that product once you've elected to enroll in it. And it's a very simple, straightforward process. For example, again, if you wanted to learn more about level funded, you would come here. Here's some more information, again, about level funded products. But once you've learned about the product and you want to get started, it's very straightforward. It's follow these steps. And the very first step is get a sample quote. And you'll see we've tried to make this as simple as possible by allowing you just to simply click on that button. It will then pop up a census document. And most of you that have current medical coverage are familiar with the census document, but we've provided the actual census document with the step-by-step process for how you need to complete that document, including information about your company and then also census information about your employees. So you'll see it's a very straightforward, simple process. Gather this information and you'll see it's simple data about your employees that you should be familiar with, and then send that information into quotes at Hamilton Insurance, and then that will initiate the process. Once the process is initiated, we'll basically reach back out to you and walk you through what the other steps are should you decide to move forward with that illustrative quote. Again, getting a sample quote does not bind you to or require you to purchase anything. It's a way for you to get a quote, see how that quote fits for you and your employees, and then go to the next step after that. So I would encourage everybody to certainly go out and get a sample quote and allow us to get you the pricing on whatever product you're interested in. And then from there, we can take you through the rest of the process. But I want to tell you that all of those processes are literally outlined on this website, but we will be reaching back out to you once you get the sample quote and walk you through what the next steps are. But they're very simple and very straightforward and all outlined on this website. So that's a very quick overview of the website. Two takeaways from my discussion is that the site is here for two important reasons. One, to provide you additional detail about the products that you're interested in. And the second most important thing is that what does it take to administer those products? And we hope at the end of the day, what we've done is two things. Provided you a great array of employee benefit products and provided you a platform to allow you to administer those products in as simple a way as possible. So taking some of that burden off of you and putting that on us. The only other thing I want to mention is that we do have another website that is associated with MBIA, and that site is geared toward individuals that you heard about earlier. So if you have individuals that want to buy medical products on a standalone individual basis, we can direct them here, and this again is the same essentially the same process. Good information about the products and step-by-step process on how they would go about buying that individual product. So you heard Chrissy and Rob talk about individual products, 1099s and HR and MEC plans and hospitalization coverage. All of that can be accessed through this website, again, with simple clicks, and you can literally go through, learn more about the products, and actually they can enroll themselves. Okay. That's a very quick overview of how the two platforms work in conjunction with all the great medical products that you've heard about here today. And with that, I'll turn it back to you, Lauren.
Great, thank you guys. A lot of great information. We do have some questions, so I'll go ahead and ask the questions. I think a lot of these can be directed to anybody, so please feel free to answer it. And I think some of them may also be different depending on the different plan. we've had several questions about this. We do have several people that either live in other states, but obviously work in Maryland and are members of the association, or they live between other states. Like we have a member that lives part of the time in South Carolina, part of the time in Maryland. How does that work with the various plans? And it may, again, be different for each plan.
I think I'd like to start. This is Rob Dooley. With Smart HRA, we actually can pick plans for those states and plans that are national plans, so they're good in all states. So that's how we can address it on an individual basis. I did want to add that individual HRA can be segmented for just hourly workers, and the management could still be on a traditional group plan. I wanted to add that that's allowable under the law. Thanks.
Hi, it's Chrissy here. So it's going to depend on what piece we're talking about, and there are a lot of arms here to the Kaiser piece. So for the association plan, so if we're doing the 51 plus eligible groups, we can offer what's called an out of area plan for those folks. As far as the 1099 piece, we can do that as well. I just texted my manager, he said, yes, we can. So for the 1099 piece, we can do an out of area plan as well for those folks. And then it depends on if you guys are gonna do some small group plans, we have offerings for that too. So we can figure that out, don't worry about that. The group does need to be situs in this service area, so we can't have a group that's out of this service area, but if there's a few one-offs, that's fine.
Great.
If I could chime in on a group basis too.
Yeah.
For the group medical products, Care First can do a national plan with the Blue Choice program that they have, and Aetna can also offer a national network on a fully insured basis or on a level funding basis for on a group basis. So a couple of products here would be the Care First product, the Aetna product, either level funded for Aetna or fully insured for Aetna or fully insured for Care First.
Great, perfect. Yeah, if anyone has any questions, again, you can please put it in the Q&A or the chat function, or you can also raise your hand if you want to ask it in person. We had another question about obtaining a sample quote from all the different product options. Is that something that people can do with this plan?
Yeah. Would you like me to answer that?
Yeah, Joe, that's your deal.
Yeah. Essentially what happens is when you submit your census to us, unless you've specified a specific group, like if you just wanted a level funded quote, we would do that. But more likely we're going to run the quote across all of those groups. And so you'll get multiple options back.
Just one thing I want to say, we're going to do an initial assessment call. So when we do get a census, one of our first steps is going to be to reach out to you and try to just get a good feel about your company, what you're doing now, and what your individual needs are, so we can kind of tailor make the options to what your specific company wants and needs.
Great. We had another question about, is there a deadline date to enroll in these? So who wants to take that? Peter?
Yeah, I'll take that. And I also want to add one other thing in terms of, I don't want people to think that this is all automatic and no personal touch on this. This is really a way to provide a range of options to an association. But the relationship that you have with us as agents is just going to be like any other relationship that you have. It's going to be very personalized. We're going to have, as Rob mentioned, conversations with you ahead of time to understand what your needs are and help you pick the plan that's going to be right for your employee population. So that's the first thing I wanted to mention. And then the second part of the question was, help me.
It was just if there was a deadline to enroll.
Oh, the deadlines. Yeah, thank you. All right, so look, there were deadlines for submitting census information so we can get some numbers from Kaiser. And that's really the only deadline in this program. If your renewal date is September 1, the best time would be to start maybe in late May, very early June, to submit your census to this program to get a proposal. So you can do this at any time throughout the course of the year, and you do not have to do it on your anniversary date. You can do this before your anniversary date or anytime.
Yeah, I want to echo what Peter just said. A lot of people believe in small group reform that that's an annual contract, and it's not an annual contract. It's a month-to-month contract, and therefore you can start a new program at the beginning of any month. So we could quote this at any time for you during the year.
And if I could add something, this is Mark Kaufman. I think it's very important that all the member companies of MBIA know that at the Warner companies and within the organization that we put together here for you, we will come out and meet with you as well. So if you're an employer that has 30 employees or 40 employees, we'll get the census data, but we want to come out and develop that relationship with you, meet with you, and do the things that you're currently more than likely doing with your incumbent broker.
Yeah, so to be clear on that too, we're all sitting here from our houses in Maryland, so we're not remote, distant folks that have no idea what goes on in the industry here. I mean, we're local employers and local employees. We've been doing business in Maryland for, we'll just say 25 plus years in the employee benefit industry. So, we're here, we're local, and we're ready to meet with you and your employees.
Great, perfect. We have another question about are the overall rates lower if more MBIA members join? You want to say that, Joe? You're shaking your head, or Peter?
Chrissy, you want to weigh in on that, on how it works?
I mean, it really depends on the overall market that we get. So I would say yes, the more we get, the better the rates are going to be. But it does depend on the market share that we get. So I guess my answer is yes to that. And I apologize. I'm glad I had a second to talk. I did want to correct something, and I apologize for this piece. Doing the 1099 piece in the associations is a very new thing. We actually cannot offer it to the out-of-area folks. So I apologize on that. My manager was misunderstanding what I said, but so we won't be able to offer it. It would just be Maryland, DC, and Northern Virginia. So I apologize for that piece.
Okay, so and then I'm going to weigh in too on the product for like Aetna and Care First, and I'm sure this is the same with Rob Billy's products in the Smart HRA, is that as we build a larger and larger book of business with MBIA, we're going to have negotiating leverage with all of the carriers that we do business with.
Great.
And to take that a step further, we also do the other lines of coverage. So let's not forget about life insurance on a group basis, disability on a group basis, dental, vision, so on and so forth. Those products are all available as well with a consolidated bill. So you would only get one bill to take care of all of your needs and all the different carriers that you work with. And then we would pay the carriers.
Great. So I know that when we had been talking before, there was various examples of what people should be doing and that kind of thing. I did have a question from somebody that's kind of a little bit of a specific example, but it may help others. So how can I submit for a quote for various plans for a family plan? Me and my two daughters. I work for a builder, but have to get my own insurance. Can somebody kind of walk us through that scenario?
That would fit under individual HRA, and it probably would also, and I don't want to speak for Kaiser, it would fit under the Kaiser rates as well. But they would fill out a census form, even if it's just one employee, and we would get that information, and we could then give the different options and the different rates for that family. But we need the ages and the sex of the family members as part of that census data.
Yeah, for Kaiser, it would be pretty much the same thing. I mean, we're going to, obviously with a full major medical health insurance plan, we're going to need to have the information from you. I think, Mark or Peter, do we have the census information on this website for them to upload for someone individually to pick up for Kaiser? Or they just get it from their company?
Let's see. I think we need to put it here. It's definitely on the group site.
Okay.
Yeah,
And it's in a lot of places on the group site.
yeah, right now I can answer that. It's not on the individual site. It is on the group site.
Okay, and just so that you all know, for Kaiser, we would need your name, date of birth for all family members, gender, zip code, and then coverage level, which means are you picking this up as one person, a family, husband and wife, someone with children, spouse and children, and then we can submit it there.
Yeah, just so to add to that, in the future, you will see on the individual site, this is the healthcare site for individuals that we talked about earlier. There will be another feature here that we're going to add in the next day or two that would allow us to do that directly, Chrissy. It would take us right to your individual quote site and, you know, work through that. And
Okay.
so the individual could literally come here, go through the site, get a quote, and based on their age, demographic, you know, all the demographics, because we're going to link directly with that new platform that you have.
Perfect, thank you.
Mm-hmm.
Great. Okay, I have a different question. It's related to one of the ones about out of state. If you are a Maryland member, meaning an MBIA member, but are out of state, away from Maryland, DC, or Northern Virginia, can you still be seen by a virtual doctor? And doing
So depending, so you'd have to live in the Maryland, DC, Northern Virginia area, but if you're traveling throughout the United States, you can absolutely be seen by a virtual doctor at any point throughout that.
Great. What about Delaware? Is Delaware still considered kind of, you'd have to use the national platform?
Truth be told, there's a zip code area, so we could have some people from Delaware, West Virginia, Pennsylvania come in here as well. We have a lot of folks that live in York, PA, and that would be fine. It's just going to depend upon where you're living in relation to a center. So I would say it's probably about a 45-mile range away from our medical centers, which are all over Maryland, DC, Northern Virginia. So if you have a question about it, send it in. We can, you know, weed that out and let you know if you can't be submitted for it.
And for the SelectMed Pro that uses the Aetna network, it's nationwide, but telemedicine can be used anywhere in the country with that product. And with the Affordable Choice product, it also has telemedicine nationwide, and it has a national network as well.
Great. I have another question. Will any of the plans be HSA compatible?
For the Kaiser piece, we could offer what has been called our Plus plan, which is what I've been talking about for the the outside doctors. And then we can also offer an HSA plan as well. So we could do two. I think Mark, Peter, and I would determine what plans to pick for the groups, but that's not a problem at all. It would not have the outside access to providers unless we got rid of the Plus plan, which I don't think I would do. So I would say we would probably be coming into the Kaiser network with the HSA plans.
That would be true on the Aetna level funded plans, the Care First fully insured plans as well.
And on Smart HRA, there are HSA eligible options as part of the individual contribution to the employee, and they could go buy an HSA plan.
Great. And another question. So am I understanding that the Kaiser option is strictly for 1099 employees or larger employee-sized businesses?
No, honestly, we could offer the Kaiser for the gamut. The two pieces that we're doing here on this website would be for the 1099 employees to get that full major medical coverage for more affordable than what they're able to get at other carriers. And then for the association, so the 51 plus, we can loop it in as one big association to get lower rates. But you can also send in quotes for small group plans. We just wouldn't be looping it in with the 1099 or the association plan. So we're circling it here, number 2. So you can also get quotes for small group as well. That's completely fine.
Great. So we have kind of a website and process question. On the main page, do I have to submit an application to each, or is there a way to do one application for all?
Joe?
An application once you decide the coverage you want, the plan that you want, or to get a quote?
I'm guessing it's probably for the quotes, but that was the question.
Yeah. So again, if you submit a quote, a census with a quote, or for a quote, we are going to have, regardless of your size, we're going to have a conversation to start that off and learn a little bit more about the organization. And that's going to help us go out and shop this, but we will get quotes. If you say, hey, I want to look at level funded, I want to look at fully insured, and I want to look at Kaiser and Care First, we're going to get quotes for all of those with one census.
Great. Yeah, we've had a lot of questions. Obviously, it is hard in this platform. Everybody's got their own situations. I had a question if people can get your contact information. We will certainly send that out to people so that they can ask specific questions for their company. And that type of thing. We also had a question. Somebody was able to only get on late, and whether we'd be sharing this webinar, and obviously we will. We'll get that webinar out to anybody that signed up for it, as well as I'm sure we'll have it on our website as well if anyone wants to kind of revisit this and ask the question. So, and then I had another question for a quote. Is that the enroll link? So I guess they're just, again, this is a process question. So if you want to get a quote, where do you go, Joe? Can you just show that again to people?
Yeah, it's very simple. Just go to either the fully insured site, fully insured product, or the level funded product, and there's going to be a button that says get a sample quote.
Right.
Okay. And it's on both, again, sorry, you'll see get fully insured medical quote. But again, the way that we're going to do that, it's going to come to us in a central place. Then, as we said earlier, someone will reach out, Rob and Peter and Mark's group will reach out to you, and then we will have a conversation about those products and see which works best for you. And it may be that we get a level funded quote. It may be that we get a level funded, a fully insured quote. It may be all of the above, and then see what works for you. But there'll be a dialogue to see what fits best for you and your employees.
So let me just add one thing here really quick to be clear. When you click on this, get a fully insured quote, you may not see it right away, but what happens is an Excel spreadsheet drops down in the bottom left-hand corner of your screen, and this is what it looks like. But the spreadsheet doesn't necessarily pop on your screen. It goes down to the bottom left part of your screen, and just click there and open it.
And it has very simple instructions. Again, for those of you who have already are familiar with getting major medical coverage quotes, it's the very same thing that you've always been accustomed to. We just tried to make it easy and put it in a nice census format for you, so you don't have to mess with it. Just come here and fill out follow the instructions, basically, and it's very limited information. And then we can all go off and running and get you a quick quote.
Joe, this is Mark. Could you please pull up that one attachment that we had up earlier?
Yeah.
I'd like to give everyone an example of the impact that we can have for organizations. This is an example of a group of approximately 80 people, and they had about 15 staff administrators and about 65, I'll say, seasonal employees. And they covered all of their employees. This particular group covered all their employees, and they got about a 20% rate increase from United Healthcare. What we were able to do is go back to the owner and implement this program where we kept them with United Healthcare, and we segmented out the staff associates with the organization, which is perfectly legal and able to do. We had, I believe, 12 or 13 enroll and stay with the United Healthcare plan. We moved the other 67 or so folks into the, or I'll say the seasonal employees, into the Enrollment First Manhattan Life product. The employer decided to pay for the ACA Flex plan I believe is $91 for all the employees. So for those 66 or 67 employees, thanks, Joe, the employer paid for them. So the long and short, and then the employee could make the choice to buy up into the Manhattan Life product if they wanted to. The long and short of it is we save the employer approximately $250,000 annually by being a little creative and doing some things that still meets all the needs of each and every employee that they have, but candidly really help this organization, stay afloat in business during these trying times. So
Yeah,
I wanted to point that out. Thank you.
Real quick to this. What you don't see here is all of the work that happened in between this. In other words, this is the top part of this was their initial renewal. We came in and showed them a variety of different options. We had Aetna in there, we had Care First Blue Cross Blue Shield in there. So they had a variety of different options, just like your current broker would do. And then, they decided that they wanted to stay with United Healthcare. We did have some lower cost items here, but they thought that staying with the network was important. So that was great. But the idea here is that we didn't just come back and say, here's what you have. We showed them a variety of options in between so that they could pick the plan that best met their employee needs.
Thanks, Joe.
Great. Well, I think there was a lot of information on this. Kind of try to wrap up at this point. If anyone has any kind of parting words, I think the biggest thing is for everybody to go to the website, check it out. We'll make sure you have the contact information, but it is all on our website to ask different questions. Obviously, it's a little bit different for each organization, and everybody's got different needs. But we're really excited about this plan. And we just put it in the chat again, the website. So if you have any other questions, please feel free to reach out to anybody on this call or any of our MBIA team members, and we can help you through the process. But we're excited about it. We think, especially during this time right now, we can offer some different things for our members as we move forward. So does anybody have any other parting words before we wrap up?
Well, we're very excited. Thank you for your time.
Yes, absolutely. Great. Thank you, everybody, and hope you have a wonderful day.
Great.
Thank you. You too.
Thank you. Thanks.